Welcome to our health channel, where we discuss important topics that affect your well-being. Today, we're going to talk about a subject that's crucial for many men and their families: prostatectomy, or the surgical removal of the prostate gland. This procedure is often used to treat prostate cancer, which is one of the most common cancers affecting men worldwide. In fact, did you know that about 1 in 8 men will be diagnosed with prostate cancer during their lifetime? That's why it's so important to understand this procedure and its effects. If you or a loved one is facing prostate cancer or considering a prostatectomy, you might be wondering, what will life be like after this surgery? It's a question that deserves a thoughtful and comprehensive answer, which is exactly what we aim to provide in this video. We'll cover everything from the types of surgery available to the recovery process and long-term effects on your quality of life. Let's start by understanding what a prostatectomy is and why it's performed. A prostatectomy is a surgical procedure to remove all or part of the prostate gland. The most common reason for this surgery is to treat prostate cancer, especially when the cancer is confined to the prostate and hasn't spread to other parts of the body. In these cases, a radical prostatectomy, where the entire prostate gland and some surrounding tissue are removed, is often the preferred treatment option. The main goal of a prostatectomy is to remove cancerous tissue and prevent the spread of cancer. By removing the prostate, doctors aim to eliminate the source of cancer cells and improve the patient's chances of long-term survival. It's important to note that while this surgery is a powerful tool in fighting prostate cancer, it's not the only option. Your doctor will consider various factors, including the stage and grade of the cancer, your overall health, and your personal preferences, before recommending prostatectomy as the best course of action. Now, let's discuss the different types of prostatectomy procedures available. There are 3 main approaches: open surgery, laparoscopic surgery, and robotic-assisted surgery. Each has its own advantages and considerations, and the choice often depends on factors such as the surgeon's expertise, the patient's condition, and the available medical facilities. Open surgery, also known as traditional prostatectomy, involves making a large incision in the lower abdomen to access and remove the prostate. This method has been used for many years and is still preferred in some cases, particularly when the cancer has spread beyond the prostate or when the prostate is very large. The advantage of open surgery is that it gives the surgeon direct access to the prostate and surrounding tissues, which can be beneficial in complex cases. However, it typically involves a longer recovery time and a larger scar compared to minimally invasive techniques. Laparoscopic surgery, on the other hand, is a minimally invasive approach. In this procedure, the surgeon makes several small incisions in the abdomen and uses long, thin instruments to remove the prostate. A tiny camera, called a laparoscope, is inserted through one of the incisions to guide the surgeon during the operation. Laparoscopic surgery often results in less blood loss, smaller scars, and a quicker recovery time compared to open surgery. However, it requires specialized training and may not be suitable for all patients or cancer types. The third option is robotic-assisted surgery, which is an advanced form of laparoscopic surgery. In this procedure, the surgeon controls robotic arms from a console near the operating table. The robotic system provides a magnified 3-dimensional view of the surgical site and allows for very precise movements. This can lead to improved outcomes in terms of cancer control and preservation of urinary and sexual function. Robotic-assisted prostatectomy has become increasingly popular due to its potential benefits, but it's important to note that the skill and experience of the surgeon are still crucial factors in the success of the operation. Each of these surgical approaches has its own set of advantages and potential drawbacks. Your doctor will discuss these options with you, considering factors such as the extent of your cancer, your overall health, the surgeon's expertise, and the available facilities. It's crucial to have an open and honest discussion with your healthcare team to determine which approach is best suited for your individual case. Regardless of the surgical method chosen, it's natural to feel anxious about undergoing such a significant procedure. That's why proper preparation is key. Before the surgery, you'll undergo a series of pre-operative tests to ensure you're healthy enough for the operation. These may include blood tests, electrocardiograms, and imaging studies. Your doctor will provide specific instructions on how to prepare for the surgery, which may include guidelines on eating, drinking, and medication use in the days leading up to the procedure. It's also important to prepare emotionally and psychologically for the surgery and recovery process. Many men find it helpful to talk to others who have undergone the procedure or to seek support from a counselor or support group. Remember, it's completely normal to have concerns and questions. Don't hesitate to discuss these with your healthcare team. Now, let's talk about what you can expect during the actual surgical procedure. The operation typically takes between 2 to 4 hours, depending on the surgical approach and the complexity of your case. You'll be under general anesthesia, which means you'll be completely asleep and won't feel any pain during the surgery. In a radical prostatectomy, the surgeon will remove the entire prostate gland, along with the seminal vesicles, glands that help produce semen, and some surrounding tissue. In some cases, nearby lymph nodes may also be removed to check for cancer spread. After removing the prostate, the surgeon will reconnect the bladder to the urethra. This is called an anastomosis. This step is crucial for restoring normal urinary function after the surgery. Following the procedure, you'll be moved to a recovery room where medical staff will closely monitor your vital signs as you wake up from the anesthesia. You may feel groggy and experience some pain or discomfort, which is normal and can be managed with medication. One of the most important aspects of immediate post-operative care is the use of a catheter. A thin, flexible tube will be inserted through your penis into your bladder to drain urine. This catheter is typically left in place for 1 to 2 weeks after the surgery to allow the anastomosis to heal properly. While having a catheter can be uncomfortable and may take some getting used to, it's a crucial part of the recovery process. As we near the end of this first part of our discussion, I want to take a moment to connect with you, our viewers. Your health journey is important to us, and we're here to support you every step of the way. If you're finding this information helpful, we'd be grateful if you could subscribe to our channel. It's a simple way to ensure you don't miss any of our upcoming health videos. Also, we'd love to know where you're watching from. Feel free to leave a comment with your city or country. Your engagement helps us create content that's most relevant to our community. Now let's continue with our discussion on prostatectomy and what you can expect during recovery. The immediate recovery period after a prostatectomy is crucial for your overall healing process. Depending on the type of surgery you've had, you may spend 1 to 3 days in the hospital. During this time, your medical team will closely monitor your condition, manage any pain or discomfort, and teach you how to care for yourself once you're discharged. One of the most common concerns after prostatectomy is pain management. It's normal to experience some discomfort, particularly around the incision site. Your doctor will prescribe pain medication to help you manage this. Remember, it's important to take your pain medication as directed. Staying ahead of the pain can help you rest more comfortably and recover more quickly. You may also notice some bleeding or bruising around the incision site. This is normal and should gradually improve over time. Your healthcare team will show you how to care for your incision, including how to keep it clean and dry to prevent infection. Another key aspect of your immediate recovery is learning to manage your catheter. As mentioned earlier, you'll have a catheter for about 1 to 2 weeks after surgery. While it may feel uncomfortable or strange at first, it's an essential part of your recovery. The catheter allows your bladder and urethra to heal properly after the surgery. Your nurses will teach you how to care for the catheter, including how to empty the bag and keep the area clean. They'll also provide you with supplies and instructions for catheter care at home. Once you're discharged from the hospital, you'll need to take it easy for a few weeks. Your doctor will give you specific instructions, but generally, you should avoid lifting heavy objects, driving, or engaging in strenuous activities for several weeks after the surgery. Light walking, however, is often encouraged as it can help prevent blood clots and promote healing. Now, let's discuss some of the common symptoms you might experience in the weeks following your prostatectomy. One of the most significant issues many men face is urinary incontinence, or difficulty controlling urine flow. This is very common after prostate removal and is usually temporary. When your catheter is removed, you may experience some leakage or difficulty controlling your urine. This happens because the surgery affects the muscles and nerves that control urination. The good news is that for most men, urinary control improves over time. In the meantime, your doctor may recommend exercises to strengthen your pelvic floor muscles, which can help improve bladder control. These exercises, often called Kegel exercises, involve tightening and relaxing the muscles that control urine flow. Your healthcare team will teach you how to perform these exercises correctly. You may also need to use incontinence pads or protective underwear for a while. Remember, this is a normal part of the recovery process, and most men see significant improvement within a few months. However, if incontinence persists or worsens, it's important to discuss this with your doctor, as there are additional treatments available. Another common postoperative symptom is mild bleeding or blood in your urine. This is normal and usually resolves on its own within a few weeks. However, if you notice heavy bleeding or blood clots, you should contact your doctor immediately. Preventing complications is a crucial part of your recovery process. One of the most important things you can do is to follow your doctor's instructions carefully, especially when it comes to caring for your catheter and incision site. Proper hygiene is essential to prevent urinary tract infections, UTIs. Make sure to wash your hands thoroughly before and after handling your catheter, and keep the area around the catheter clean and dry. It's also important to stay hydrated and maintain a healthy diet to promote healing and prevent constipation, which can be a side effect of pain medication. Your doctor may recommend stool softeners or laxatives to help manage this. Another key aspect of preventing complications is recognizing the signs of potential problems. You should contact your doctor immediately if you experience 1. Fever or chills, which could indicate an infection. 2. Severe pain that isn't relieved by your prescribed medication. 3. Heavy bleeding or large blood clots in your urine. 4. Inability to urinate once your catheter is removed. 5. Swelling or redness around your incision that gets worse instead of better. Remember, it's always better to err on the side of caution and contact your healthcare provider if you have any concerns. Now, let's talk about a topic that's often on men's minds after prostatectomy: the impact on sexual function. It's important to understand that the prostate plays a role in sexual function, so its removal can lead to changes in your sex life. However, these changes don't mean the end of your sex life. They're challenges that can often be overcome with time, patience, and sometimes medical intervention. One of the most common issues men face after prostatectomy is erectile dysfunction, ED. The nerves that control erections run very close to the prostate, and they can be affected during surgery, even with nerve-sparing techniques. It's important to understand that recovery of erectile function is often a gradual process that can take up to 2 years. During this recovery period, there are several treatment options available to help with ED. These include oral medications like sildenafil, Viagra, or tadalafil, Cialis, vacuum erection devices, and injectable medications. Your doctor will discuss these options with you and help you find the best solution for your situation. It's worth noting that while you may experience ED, you can still feel sexual pleasure and reach orgasm. However, you will no longer ejaculate semen during orgasm. This is because the prostate and seminal vesicles, which produce semen, have been removed. This change, known as a dry orgasm, doesn't reduce sexual pleasure, but it does mean that you will no longer be able to father children through natural means after a prostatectomy. For men who wish to have children in the future, it's important to discuss fertility preservation options, such as sperm banking, before the surgery. Your healthcare team can provide guidance on these options. As we discuss these sensitive topics, I want to remind you that you're not alone in this journey. Many men have gone through this process and have found ways to adapt and maintain a fulfilling life. If you're finding this information helpful, please consider subscribing to our channel. We regularly post videos on various health topics that could be beneficial for you or your loved ones. Also, we'd love to hear from you. Let us know in the comments what city or country you're watching from. Your engagement helps us create content that's most relevant to our diverse community. As we continue our discussion about life after prostatectomy, it's important to address the long-term recovery process and how to adapt to your new normal. Remember, every person's recovery journey is unique, and it's crucial to be patient with yourself and maintain open communication with your healthcare team. In the months following your surgery, you'll likely have regular follow-up appointments with your doctor. These visits are essential for monitoring your recovery progress and addressing any concerns you may have. Your doctor will typically perform physical exams and order blood tests to check your PSA, prostate-specific antigen levels. PSA tests are crucial for monitoring the effectiveness of your cancer treatment and detecting any potential recurrence early. Many men find that their urinary control continues to improve over time. However, if you're still experiencing significant incontinence several months after surgery, don't hesitate to discuss this with your doctor. There are additional treatments available, such as pelvic floor physical therapy, medications, or even surgical procedures like sling placement or artificial sphincter implantation, which can help improve urinary control. Similarly, erectile function often continues to improve for up to 2 years after surgery. If you're struggling with ED, it's important to keep an open dialogue with your doctor. They may adjust your treatment plan or suggest alternative therapies as your recovery progresses. Remember, restoring sexual function is often a process that requires patience and persistence. Beyond the physical aspects of recovery, it's crucial to address the emotional and psychological impact of prostate cancer and prostatectomy. Many men experience feelings of anxiety, depression, or changes in their self-image following the surgery. These feelings are normal and valid. Don't hesitate to seek support from a mental health professional, join a support group, or talk to others who have gone through similar experiences. Your emotional well-being is just as important as your physical recovery. Adapting to life after prostatectomy also involves making some lifestyle changes. Maintaining a healthy diet and regular exercise routine can help support your overall recovery and improve your quality of life. Your doctor may recommend specific dietary guidelines, particularly if you're experiencing any gastrointestinal side effects from the surgery or subsequent treatments. It's also important to stay vigilant about your overall health. Prostate cancer. Survivors have an increased risk of developing other types of cancer, so it's crucial to keep up with regular health screenings and maintain a healthy lifestyle. This includes not smoking, limiting alcohol consumption, maintaining a healthy weight, and staying physically active. Now, let's talk about the impact of prostatectomy on your daily life and relationships. One of the most significant changes you may experience is in your urinary habits. Even after you've regained good urinary control, you might find that you need to urinate more frequently or urgently than before. This is because the bladder has to adjust to the absence of the prostate. Over time, most men adapt to these changes, but it may require some lifestyle adjustments, such as planning bathroom breaks more carefully when you're out and about. Your sexual relationships may also undergo changes. It's important to have open and honest communication with your partner about these changes. Remember, intimacy is about more than just sexual intercourse. Many couples find new ways to be intimate and maintain closeness during the recovery period and beyond. If you're struggling with these changes, consider speaking with a sex therapist or counselor who specializes in working with cancer survivors. It's also worth noting that prostatectomy can sometimes lead to changes in penile length or shape. This is usually temporary and improves over time, but it can be distressing for some men. If you're concerned about these changes, don't hesitate to discuss them with your doctor. There are exercises and devices that can help maintain penile health and potentially mitigate these effects. Another aspect of life after prostatectomy that's important to address is the potential impact on your work and social life. Depending on the nature of your job, you may need to take several weeks off work to recover. When you do return to work, you might need to make some adjustments, especially if your job involves heavy lifting or prolonged periods of sitting. Be sure to communicate with your employer about any necessary accommodations. In terms of your social life, you may find that you need to make some temporary adjustments, particularly in the early stages of recovery. For example, you might need to avoid activities that put strain on your pelvic area, or you may need to plan outings around bathroom accessibility. However, it's important to maintain social connections and engage in activities you enjoy, as these can significantly contribute to your overall well-being and recovery. As we near the end of this section, I want to emphasize the importance of self-advocacy in your healthcare journey. Don't hesitate to ask questions. Seek second opinions if needed, and actively participate in decisions about your care. Your healthcare team is there to support you, but you are the expert on your own body and experiences. Before we move on to our final section, I'd like to take a moment to connect with you, our valued viewers. Your health journey is important to us, and we're committed to providing you with reliable, helpful information. If you're finding this video informative, we'd greatly appreciate it if you could subscribe to our channel. By subscribing, you'll ensure that you don't miss any of our future health-related content. Also, we're curious to know where our viewers are from. Please feel free to share your city or country in the comments section. Your engagement helps us today. As we continue our discussion about life after prostatectomy, it's important to address the long-term recovery process. While the immediate post-operative period is crucial, your journey to full recovery extends well beyond those initial weeks. Let's explore what you can expect in the months and years following your surgery. One of the most significant aspects of long-term recovery is the ongoing medical follow-up. After your prostatectomy, you'll need to maintain regular checkups with your urologist or oncologist. These appointments are crucial for monitoring your recovery progress and ensuring that there are no signs of cancer recurrence. A key part of these follow-up visits will be PSA, prostate-specific antigen testing. PSA is a protein produced by prostate cells, and its levels in the blood can indicate the presence of prostate cancer. After a radical prostatectomy, your PSA levels should be undetectable, as the entire prostate gland has been removed. Your doctor will schedule regular PSA tests to monitor for any changes that could indicate a return of the cancer. The frequency of these tests will depend on your individual case, but typically, you can expect PSA testing every 3 to 6 months for the first few years after surgery, and then annually after that. It's important to keep all of these appointments and to discuss any concerns or new symptoms with your healthcare provider, no matter how small they may seem. In addition to PSA testing, your doctor may recommend other follow-up tests or imaging studies depending on your specific situation. These could include bone scans, CT scans, or MRI scans to check for any spread of cancer. Remember, these tests are precautionary measures to ensure your continued health and well-being. Now, let's talk about the physical changes and adaptations you might experience in the long term. As we discussed earlier, urinary incontinence is a common issue immediately after surgery. For most men, this improves significantly within the first few months. However, some men may continue to experience some degree of incontinence for a longer period. If you're still dealing with incontinence after several months, don't lose hope. There are various treatments available that can help improve bladder control. These might include 1. Pelvic floor physical therapy, a specialized form of physical therapy that can help strengthen the muscles controlling urination. 2. Medications. Certain drugs can help improve bladder control. 3. Surgical interventions. In some cases, procedures such as sling surgery or artificial urinary sphincter implantation can provide a more permanent solution to incontinence. Your healthcare team will work with you to find the best solution for your specific situation. Remember, it's important to be patient with your body and to communicate openly with your doctors about any ongoing issues. Regarding sexual function, as we mentioned earlier, recovery can take time, up to 2 years in some cases. During this period, it's important to maintain open communication with your partner about your experiences and feelings. Many couples find that exploring new ways of intimacy and maintaining physical closeness can help strengthen their relationship during this time of adjustment. If erectile dysfunction persists, there are several long-term treatment options available. These include 1. Oral medications, drugs like sildenafil, Viagra, tadalafil, Cialis, or vardenafil, Levitra, can be effective for many men. 2. Vacuum erection devices. These mechanical pumps can help achieve and maintain an erection. 3. Penile injections. Medications injected directly into the penis can produce an erection. 4. Penile implants. For some men, a surgically implanted device can be an effective solution. Your urologist can help you navigate these options and find the best approach for you. Remember, sexual health is an important part of overall well-being, and there's no shame in seeking help in this area. Another long-term consideration after prostatectomy is the potential impact on your emotional and psychological well-being. It's not uncommon for men to experience feelings of anxiety, depression, or changes in their sense of masculinity following prostate cancer treatment. These feelings are valid and deserve attention. If you're struggling emotionally, it's important to reach out for support. This could involve talking to a mental health professional, joining a support group for prostate cancer survivors, or simply opening up to trusted friends and family members. Many men find that connecting with others who have gone through similar experiences can be incredibly helpful. It's also worth noting that your lifestyle choices can play a significant role in your long-term health after prostatectomy. Maintaining a healthy diet, regular exercise routine, and avoiding harmful habits, like smoking, can all contribute to your overall well-being and potentially reduce the risk of cancer recurrence. As we discuss these long-term aspects of recovery, I want to take a moment to connect with you, our viewers. Your journey after prostatectomy is unique, and we hope that the information we're providing is helpful in navigating this path. If you're finding value in this video, we'd be grateful if you could subscribe to our channel. Your support helps us continue creating informative content on important health topics. Also, we'd love to know where you're watching from. Feel free to share your city or country in the comments. Hearing from our global community helps us tailor our content to better serve your needs. Now, let's talk about how prostatectomy might affect your overall quality of life. While the surgery and recovery process can be challenging, many men find that their quality of life improves over time as they adjust to the changes and overcome initial hurdles. One positive aspect that many men report is a sense of relief after the cancer has been removed. Knowing that the primary source of cancer is gone can provide significant peace of mind. However, it's also normal to experience some anxiety about the possibility of recurrence. This is where regular follow-ups and maintaining a healthy lifestyle can help both physically and mentally. Many men also find that going through this experience leads to positive life changes. Some report becoming more health conscious, improving their diet and exercise habits, or finding new ways to reduce stress in their lives. Others find that the experience brings them closer to their loved ones or gives them a new appreciation for life. It's important to remember that everyone's experience is different. Some men may find that they adapt quickly to life after prostatectomy, while others may face more challenges. Whatever your experience, it's important to be patient with yourself and to seek support when you need it. As we near the end of this section, let's recap some key points about long-term recovery after prostatectomy. 1. Regular medical follow-ups and PSA testing are crucial for monitoring your health. 2. Improvements in urinary control and sexual function can continue for up to 2 years post-surgery. 3. There are various treatment options available if you continue to experience issues with incontinence or erectile dysfunction. 4. Emotional and psychological well-being are important aspects of recovery, and it's okay to seek support in this area. 5. Lifestyle choices can play a significant role in your overall health and well-being after surgery. Remember, recovery is a journey, and it's okay to have ups and downs along the way. The key is to stay informed, maintain open communication with your healthcare team, and seek support when you need it. As we continue our discussion on life after prostatectomy, it's important to address some of the less talked about but equally significant aspects of recovery. One such aspect is the potential changes in your body image and self-perception. It's not uncommon for men to feel a shift in how they view themselves after prostate surgery. Some men may experience feelings of loss or an altered sense of masculinity. These feelings can stem from various factors, such as changes in sexual function, the presence of surgical scars, or simply the experience of going through a major health challenge. It's crucial to understand that these feelings are normal and valid. Embracing and working through these emotions is an important part of the healing process. If you're struggling with body image issues after your prostatectomy, consider the following strategies. 1. Practice self-compassion. Be kind to yourself and acknowledge that your body has been through a significant event. Give yourself time to heal and adjust. 2. Focus on what your body can do. Instead of dwelling on changes or limitations, try to appreciate what your body is capable of, including its ability to heal and recover. 3. Communicate with your partner. If you're in a relationship, open and honest communication about your feelings can help foster and seek professional help. A therapist or counselor experienced in working with cancer survivors can provide valuable support and coping strategies. Remember, your worth as a person is not defined by your prostate or your sexual function. You are much more than that, and your experiences can even lead to personal growth and a deeper appreciation for life. Now, let's discuss the importance of lifestyle choices in your long-term recovery and overall health. While the prostatectomy has removed the primary source of cancer, adopting a healthy lifestyle can play a crucial role in preventing cancer recurrence and improving your general well-being. Diet is a key factor in maintaining good health after prostatectomy. While no specific diet has been proven to prevent prostate cancer recurrence, a balanced, nutritious diet can support your overall health and potentially reduce the risk of other health issues. Consider the following dietary recommendations. 1. Increase your intake of fruits and vegetables. These are rich in vitamins, minerals, and antioxidants that support overall health. 2. Choose whole grains over refined grains. Whole grains provide more nutrients and fiber. 3. Limit red meat consumption. Some studies suggest that high red meat intake may be associated with increased cancer risk. 4. Include sources of healthy fats. Foods like fish, nuts, and olive oil contain beneficial omega-3 fatty acids. 5. Stay hydrated. Drinking plenty of water is important for overall health and can help manage any lingering urinary symptoms. Regular physical activity is another crucial aspect of a healthy lifestyle after prostatectomy. Exercise can help you maintain a healthy weight, boost your energy levels, improve your mood, and potentially reduce the risk of cancer recurrence. The American Cancer Society recommends at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week for cancer survivors. Before starting any new exercise routine, it's important to consult with your doctor. They can provide guidance on when it's safe to begin exercising after surgery and what types of activities are appropriate for you. Generally, a combination of cardiovascular exercise and strength training is beneficial. Activities like walking, swimming, and cycling are often good options for getting started. Stress management is another important aspect of your post-prostatectomy lifestyle. Chronic stress can negatively impact your physical and mental health, potentially affecting your recovery and overall well-being. Consider incorporating stress reduction techniques into your daily routine, such as 1. Meditation or mindfulness practices. 2. Deep breathing exercises. 3. Yoga or Tai Chi. 4. Engaging in hobbies or activities you enjoy. 5. Spending time in nature. Remember, managing stress isn't about eliminating all sources of stress from your life, but rather about developing healthy ways to cope with stress when it occurs. Another lifestyle factor to consider is sleep. Getting adequate, quality sleep is crucial for your body's healing processes and overall health. If you're having trouble sleeping, which is not uncommon after major surgery, try the following. 1. Stick to a consistent sleep schedule. 2. Create a relaxing bedtime routine. 3. Ensure your sleeping environment is comfortable and conducive to rest. 4. Avoid caffeine and electronics close to bedtime. 5. If sleep problems persist, discuss them with your healthcare provider. As we near the end of this section, I'd like to take a moment to connect with our viewers. Your health journey is important to us, and we hope that the information we're providing is helpful in your recovery process or in supporting a loved one. If you're finding value in this video, we'd be incredibly grateful if you could hit the subscribe button. Your support allows us to continue creating in-depth, informative content on crucial health topics. Also, we're always curious to know where our viewers are from. Feel free to share your city or country in the comments section below. Your engagement helps us understand our audience better and tailor our content to serve you better. Now, let's discuss the importance of ongoing support in your recovery journey. While the immediate post-surgical period often comes with a lot of attention and support from healthcare providers and loved ones, it's important to remember that recovery is a long-term process. Continued support can be crucial for your physical and emotional well-being. One valuable resource for ongoing support is prostate cancer support groups. These groups bring together men who have gone through similar experiences, providing a space to share concerns, ask questions, and learn from others. Many men find that these groups offer a unique form of support that even well-meaning friends and family can't provide. You can often find these groups through your local hospital, cancer center, or organizations like the American Cancer Society. Online forums and communities can also be valuable sources of support, especially if you live in an area without in-person support groups or if you prefer the anonymity of online interaction. However, always remember to verify any medical information you receive online with your healthcare provider. Your healthcare team remains an important source of support even long after your surgery. Don't hesitate to reach out to them with questions or concerns, no matter how much time has passed since your procedure. They can provide valuable guidance on managing long-term side effects, addressing new health concerns, and maintaining your overall well-being. Family and friends can also play a crucial role in your ongoing recovery. However, it's important to communicate your needs clearly, as they may not always know how best to support you. Be open about what you're experiencing, and don't be afraid to ask for help when you need it. As we wrap up this section, remember that recovery after prostatectomy is a journey, not a destination. There may be challenges along the way, but with the right support, information, and mindset, many men find that they can adapt to their new normal and lead fulfilling, healthy lives after prostate cancer treatment. In our final section, we'll summarize the key points we've covered and provide some closing thoughts on life after prostatectomy. Stay tuned for this important conclusion to our discussion. As we reach the conclusion of our discussion on life after prostatectomy, let's take a moment to recap the key points we've covered and offer some final thoughts on this important journey. We began by discussing the immediate post-operative period, including what to expect in the hospital and during your first few weeks at home. We talked about pain management, catheter care, and the importance of following your doctor's instructions for a smooth recovery. Remember, this initial recovery period is crucial, but it's just the beginning of your journey. We then delved into common post-operative symptoms and how to manage them. Urinary incontinence and erectile dysfunction are two of the most significant concerns for many men after prostatectomy. We discussed how these issues often improve over time and explored various treatment options available if these problems persist. It's crucial to remember that every man's recovery is unique, and it's important to be patient with your body as it heals. We also address the long-term aspects of recovery, including the need for ongoing medical follow-ups and PSA testing. Regular checkups with your healthcare team are vital for monitoring your health and catching any potential issues early. We emphasized the importance of maintaining open communication with your doctors and never hesitating to voice your concerns or ask questions. Throughout our discussion, we've touched on the emotional and psychological aspects of recovering from prostatectomy. It's normal to experience a range of emotions during this process, from anxiety about cancer recurrence to frustration with physical changes. We encouraged seeking support through professional counseling, support groups, or simply by opening up to trusted friends and family members. Remember, taking care of your mental health is just as important as your physical recovery. We also explored how lifestyle choices can play a significant role in your long-term health after prostatectomy. A balanced diet, regular exercise, stress management, and good sleep habits can all contribute to your overall well-being and potentially reduce the risk of cancer recurrence. We encourage you to view your prostatectomy as an opportunity to make positive changes in your life that can benefit your health for years to come. Now, as we conclude, I want to emphasize a crucial point. Life after prostatectomy can be fulfilling and rewarding. While the journey may present challenges, many men find that they are able to adapt to changes and maintain a high quality of life. Some even report that the experience leads to positive life changes, such as improved health habits or a deeper appreciation for life and relationships. It's important to remember that you are more than your prostate or your cancer diagnosis. Your worth as a person is not defined by your sexual function or any physical changes you may experience. Instead, focus on the strength and resilience you've demonstrated in facing this health challenge. Allow yourself to grow from this experience and use it as a catalyst for positive change in your life. As you move forward, remember that you're not alone on this journey. Your healthcare team, support groups, loved ones, and fellow survivors are all valuable resources. Don't hesitate to lean on these support systems when you need them. Sharing your experiences and concerns can not only help you, but may also provide comfort and guidance to others facing similar challenges. We've covered a lot of information in this video, and it might feel overwhelming at times. That's perfectly normal. Remember, you don't need to have everything figured out right away. Recovery is a process, and it's okay to take it one day at a time. Be patient with yourself, celebrate small victories, and don't hesitate to ask for help when you need it. Before we close, I want to take a moment to thank you for joining us for this important discussion. Your health and well-being matter to us, and we hope that the information we've provided will be helpful in your journey after prostatectomy. If you found this video valuable, we would be incredibly grateful if you could subscribe to our channel. Your support enables us to continue creating in-depth, informative content on crucial health topics. We'd also love to hear from you. What aspects of life after prostatectomy would you like us to explore in future videos? Are there any topics we covered that you'd like us to delve into more deeply? Please share your thoughts in the comments section below. And don't forget to let us know what city or country you're watching from. It's always fascinating to see how far our community reaches. Remember, knowledge is power when it comes to your health. Stay informed, stay proactive, and most importantly, stay hopeful. Many men have walked this path before you and have found ways to thrive after prostatectomy. With the right information, support, and attitude, you can too. Thank you for watching, and we wish you the very best on your journey to health and wellness. Until next time, take care and be well.